Hello and welcome to Back to Health, where we promote the fact that your body can heal itself. It needs no help in doing so, just no interference, because the power that made your body can heal your body. It happens no other way. This episode is brought to you by the Mcleod Chiropractic Center in Shelby Township, Michigan. We're located on Van Dyke between 21 and 22 Mile Roads on the west side of the street in the Midtown Plaza. We specialize in health restoration. You can contact us at area code 586-739-6262 or on the web at www.correctthecause.com. Today, we're going to talk about a topic that plagues millions of people every single year: low back pain. What is it? What causes it? And how do we treat it? Stay tuned as we get back to health. Welcome back. My name is Dr. Scott Mcleod, and today we're talking about a condition which plagues millions of people every single year, and that condition is low back pain. Low back pain is such a problem that over 85% of the population will deal with it at some point in their life. That's almost everybody. It's such a problem that the costs of treating this condition are well over $10 billion every single year. So what is low back pain? Well, it can be characterized by a number of different symptoms. Some people might describe it as them having sharp shooting or stabbing type of pain in the low back or lumbar region. Some may use adjectives like soreness or throbbing or dull, aching kind of a pain in that lower back area. It can also include symptoms such as numbness or tingling in the low back and even into the hip region. But what causes low back pain? Low back pain's most common cause is due to pinched nerves in the lumbar spine. Nerves that are pinched can be very painful because of the very fact that nerves have a lot of sensory fibers in them. So when there are pinched nerves, pain can be a direct result. There can be common associated factors along with it. The common associated factors can be things like muscle spasms or soft tissue involvement, and then including inflammation. Now, what are some common treatments? Well, some of the most common treatments include things like over-the-counter medication. That's usually the first place that people will go to. They'll go across the street to their drugstore and they'll take some over-the-counter medication. Unfortunately, these types of treatments are very ineffective. They have very mild effects, if any at all. So, as that's ineffective, they end up making an appointment at their medical doctor's office. And they find themselves in the medical doctor's office for a prescription. Some of the common prescriptions for low back pain are things like anti-inflammatories and muscle relaxers. Now, these are only mildly effective as well, and the reason is because they only treat the associated factors of the low back pain. For example, the muscle relaxers will only deal with the muscle spasm component. The anti-inflammatories will only relieve inflammation temporarily that is a result of the original core cause of the problem. And they only last a short period of time. Once they wear off, additional rounds are necessary. And then after taking those for a while, people usually find that they're still now ineffective and end up going back to their doctor. At that point, the doctor may prescribe something like physical therapy. I highly recommend physical therapy for rehabilitation from trauma or injury. However, physical therapy does not correct the most common cause of low back pain. So, as physical therapy can exercise or strengthen some of those core areas, it doesn't correct the cause of the problem, and people find themselves still dealing with the low back pain down the road. They find themselves back in their doctor's office, and the next course of treatment that's prescribed is usually injections, spinal nerve root injections. Yes, these are pretty serious. These types of medications last longer, where oral types of prescribed medication are temporary and only last for a matter of hours. These types of injections last for a matter of weeks. However, they're steroidal in nature and have many side effects, and only a few rounds can be given before they can't be given anymore. Since they don't correct the cause of the problem, the back pain ends up coming back. And then the patient finds themselves usually in line for some sort of surgery to try to deal with the pain itself. Surgery also addresses the complicating factors, but never the cause of the problem. And then there's chiropractic. Now notice I waited till the end before we talked about chiropractic. Why? Because that's usually what people end up doing themselves. They usually end up waiting until they've tried everything else. Ironically, chiropractic is not only the least invasive form of treatment for low back pain, it is the most effective form of treatment for low back pain. In fact, several studies have been done. Government-funded studies have been done showing that the treatments given by chiropractors are the most effective form of low back pain treatment and the cheapest or the least expensive form of treatment. So it not only costs the least, but it also is the most effective without using any type of invasive measures. So most people, for some reason, end up waiting till the end. We find people come into our office all the time saying, I've tried everything. I've been to my doctor, I've taken medication, I've done physical therapy, I've done the injections. They want to put me in surgery now. I don't know what to do. I've given up hope. So I find myself here in the chiropractic office asking if there's anything that can be done. Chiropractic offers very effective treatment for low back pain. Why? Because we address the core cause of the problem. Chiropractors correct a condition known as vertebral subluxations. Vertebral subluxations are a condition of the spine where one or more of the bones move out of place, get locked out of place, and pinch nerves. When those nerves become pinched, they can not only irritate those very sensitive pain fibers, but cause interference of the nerve flow going through those nerves, which interferes with the mental impulses arising in the brain and going to wherever those nerves end up controlling and functioning. Chiropractors are the only healthcare providers trained to locate, analyze, and correct vertebral subluxations. By correcting the subluxation, not only alleviates the pain, but allows the nerve flow to open up. Removing the interference allows the body to function better. So not only do people feel better under chiropractic, they function better under chiropractic care. So may I suggest that if you've ever dealt with low back pain, especially of the minor varieties, get it taken care of by a chiropractor as quickly as possible. You see, low back pain can range from a number of different intensities, from it being a nuisance to getting to a point where it's affecting the level of function that you have on a daily basis, to debilitating status. We're talking 911 type of pain, where the patient can't even move without being in excruciating type of pain. Researchers suggest that almost 10% of the population are in that level of low back pain right now. If you've ever had low back pain, get it checked by a chiropractor as soon as possible. Get the problem corrected as soon as possible. You see, chiropractors don't medicate the pinched nerve. Chiropractors don't exercise the pinched nerve. Chiropractors don't inject the pinched nerve, and chiropractors certainly don't cut around the pinched nerve. Chiropractors correct the cause of the pinched nerve, which allows the body to feel better, function better, and heal itself. This is Dr. Scott Mcleod reminding you that your health is your most valuable asset. Guard it well.